From facelifts to tummy tucks and everything in between, cosmetic surgery is a fast-growing part of the healthcare industry. And the question for you is it right for you? With the answer, local cosmetic surgeon Dr. Darshan Shah joins us in the 970 studios. Good morning, doctor. How are you?
Good morning. Thank you so much for having me here today,
Thank
Jeff.
you for being here. Gosh, it's a pleasure. What are some of the most common procedures that you're performing on a regular basis?
Well, with the advent of gastric bypass and these reality shows, procedures are getting more and more common. And it used to be something that people would do, for vanity's sakes. And now it's not getting... It's getting to the point where it's almost reconstructive. We're doing a lot of tummy tucks after gastric bypass, and even after women have children. My number one type of patient that comes in is after women are done having their kids, they want to get back to their old self. So they get a little tummy tuck, maybe some work done on their breasts, just to get them back to where they were before the kids.
I guess the old concept of cosmetic surgery just had to do with the facelift. You heard about somebody getting a facelift, but really there's probably nothing on the human body that you can't improve if you, just with the right technique. Is that right?
Well, that's true. I mean, the facelift was the defining surgery of plastic surgeons because of Hollywood, and you see all these people with their faces pulled back. But really, it's not that way anymore. With discretion and good medical judgment, we can improve a lot of different things on a person's body, and newer techniques are coming out that are more minimally invasive, where we can do some major improvements with minimal scarring.
Who are the best candidates for cosmetic surgery, or does that depend on the procedure?
It really depends on the procedure, but generally you should be a healthy person. The more medical problems you have, the more complicated your procedure becomes. And with most procedures, I persuade people who are smoking to stop smoking for at least 3 months. And if you can't stop smoking, you really shouldn't have any major cosmetic surgery procedures done.
Is that because of just the health risks?
Well, smoking has two problems with it. There's carbon monoxide and also nicotine in the cigarettes, and both of those decrease blood supply to your skin. And those incisions heal terribly if you have carbon monoxide and nicotine in your bloodstream.
Yeah, I guess you're a detail guy, aren't you?
Yeah, I gotta
make sure those little sutures are that the scars don't show. Huh?
Exactly.
I guess there's a concept, doctor, that people have to go to Beverly Hills to find a good cosmetic surgeon. And is there? I mean, I'm sure there are good ones all around the country, but
right, there are great ones all over the place. I mean, Beverly Hills does have that kind of Hollywood stigma associated with it, and people think that. But in all honesty, I do, and this is coming from the people that track these things. I do 5 or 6 times as much surgery as some of those guys in Beverly Hills do. So you really have to look at the experience of the person, not just their address. I came to Bakersfield because I'm from here and I like this town and I love living here. It's a lot easier lifestyle than living down in Beverly Hills.
Yeah.
And I do just as much, if not more, than those guys do.
Well, you're busy anyway. You're operating 4 days a week?
4 days a week, yeah.
Wow. What does that say about the demand for people who want either reconstructive or cosmetic surgery?
Yeah, we were talking a little bit about this. With the advent of the reality shows, making it more and more mainstream, it's not a taboo subject anymore. People are really considering it just to get back to the way they were. And so that's increased the demand. And also the demand has greatly increased the gastric bypass because, it's really sad. I see a lot of people having undergone gastric bypass, women especially, that say sometimes they wish they never had it done because of all the extra skin. Well, that's where we come in as plastic and reconstructive surgeons to make things go back to the way they were if they hadn't gained all that weight to begin with.
Is it a misconception to assume that more women have plastic surgery than men?
Absolutely. I mean, we're seeing almost 25 to 30% of our practices becoming men, and it's increasing more and more and more every year. I think even though the procedures that men seek are, of course, different and sometimes less complex than what women have to have done because they are still having the babies,
right.
More and more men are seeking cosmetic surgery.
Where do you draw the line, doctor, when somebody comes to you and they've had all these procedures done and they just want to keep following the dream of having a perfect body? Is there a line where you say, I think you've had enough, or is that your place?
Absolutely no. I mean, you'd be surprised. Every consult day, I'll send 5 or 6 people home saying, "I'm sorry, I just can't help you," because there are a lot of warning signs. Multiple cosmetic surgeries, people that look perfect in my eye, and they still don't feel that they themselves are perfect. Those are kind of things that make us feel, maybe this person is someone that's not ever going to be happy, and they need other intervention. So we're very, very careful. We have a lot of training to pick up those type of personality traits.
If people want more information, doctor, about the procedures that you offer, if they just want to find out if it's right for them, can they call your office? Can they look
Absolutely.
online?
And that's one of the reasons I believe in not charging someone for my opinion. And people can come in, get a free consultation with me anytime. I'll give them my opinion. And if they choose to proceed with something, then we'll talk some more. But I love to talk to people and give them an honest opinion about what they need as though they were my own family member.
And your number is?
It's 665-0191. 665. And I also have a website, www.drshaw.com. That's DRSHAH.com.
Okay, Doctor, thank you so much. We appreciate your time, and it's been very informative. And I know a lot of people out there probably going to be picking up the phone right about now. But we hope to have you back.
I look forward to seeing you again.
Happy
Take
holidays.
Care. You too.
Dr. Darshan Shah from Dr. Shah here in Bakersfield also has an office in Beverly Hills. And if you'd like more information, call 665-0191 or visit him on the web at www.drshah.com.